It is unclear what the direct causes of sensory processing disorders are, especially because the disorders exist on a wide spectrum. The Sensory Processing Disorder Foundation states, sensory processing disorders are likely to be the result of both genetic and environmental factors. Research shows children suffering from sensory processing disorders displayed measurable differences in both brain structure and brain activity. Exposure to teratogens, prenatal illness, maternal stress, traumatic or difficult births, physical, sexual, psychological abuse, neglect, and post-traumatic stress disorder have all been identified as contributing factors. Most people affected by sensory processing disorders also suffer from various food allergies. However, a single cause has yet to be determined.
Symptoms of sensory processing disorder exist on a spectrum, affecting the sense of hearing, sight, smell, tactile, and taste, wherein children affected by the disorder are unable to properly allocate responses and behave accordingly. People with this disorder can be over or under responsive to sensory input. Children with sensory processing disorder may scream when touched and may recoil from the textures of certain food, or unable to process command received or written. Sensory processing disorder may affect only one sense, such as sight or hearing, or it can affect multiple senses. Some behavioral symptoms of children with sensory processing disorder are they do not engage in creative activities, they are withdrawn when touched, they also have difficulties with certain movement such as sliding, swinging, and going downstairs.
Sensory processing disorder is often treated occupationally by teaching the child to be more comfortable with the environments he or she most frequently encounters, such as home and school. The child must learn to be less avoidant of the tasks and demands expected of the child. Therapies include drawing, playing, singing, and dancing. These activities are done both one-on-one and in group settings. The gradual and methodical introduction of new stimuli helps the child perceive the environment as predictable and safe. An educator's ability to recognize the signs and symptoms of sensory processing disorder is key to helping a child get the appropriate treatment at an early age before undesired neurological patterns become harder to reverse.
As sensory processing disorders continue to be prevalent throughout society, identifying such occurrences accurately becomes a significant matter, consequently so that one would be able to care for the well-being of their fellow persons. The most crucial circumstance for identifying SPDs are often with children, due to them being in a critical stage of development. Thus, having awareness of the symptoms, effects, and presence is vital for those who are often interacting with children. Owed to the lack of specialized awareness for SPD, it has often been misdiagnosed to be a more renowned disorder that shares similar symptoms. Awareness is the first factor that needs to be of concern, but without distribution of awareness, actions cannot follow. Ideally, the distribution of awareness should be professionally and publicly dispersed. Caretakers, social workers, educators, health professionals, and whomever may be around other people should know how to identify SPD so that the recipient can receive proper treatment. Although many disorders will take priority over SPD, it is still important that we ensure that our children are given the means for proper development, in addition to warranting that our health organizations do not treat a disorder that simply is not existent within the recipient.
Social development happens to be a crucial aspect of a child's development. During what Erickson considered the third stage of social development, children need to learn to cooperate with others. The ability to cooperate leads to the ability to relate to peers based upon society's rules, which requires learning those rules based upon the perspective of the child's peers. Vygotsky felt that social interaction, social learning, was a necessary foundation of all other styles of learning and development. Piaget felt that classroom learning was enhanced when a collaborative approach was utilized so that children could learn from each other. A child with intense and persistent sensory needs finds difficulty with everyday activities that are necessary for social, emotional, and educational growth. The social activities hampered due to the physiological disabilities of children with sensory processing disorder. All other levels of learning are also minimized. However, many resources are available online, allowing access to information and materials as well as tips and tricks for helping children with SPD in their social development. Educating oneself and then the other children in your classroom about any child who has SPD will help mitigate the problems associated with social development and learning in school environments, thereby educating the entire child.